Interstim is a proprietary pacemaker developed by a Medtronic company, and it helps in various pelvic floor disorders, which includes various urological applications also. So it's in one word we can say it's a pacemaker device developed for pelvic floor problems. Patients in urology presenting with various voiding symptoms, particularly urge incontinence, as I discussed with the Botox and pelvic exercises. So it is an extreme form of treatment for such patients in whom the previous treatments have failed. The other group is those who have pelvic floor spasticity, and lately some role has been found for patients who have pelvic pain. So these are the three groups who would need it once the less invasive therapies have completely failed. It is a surgical procedure which is not categorized as a major surgical procedure. In fact, it is done under what we call as local anesthesia when the patient is awake, and we give only numbing injections. It is done in 3 stages. In the first stage, we place a electronic lead in close to one of the nerves, and then attach that to a external pacemaker, and the patient goes home with this contraption. Then the pacemaker is activated and the patient is told to feel the benefit or no benefit. Once it is sure that the patient has benefited from this kind of electrical signals, then they are called back and the device is turned off. By turning off, we wait for another couple of weeks to understand whether the symptoms are coming back or they are kind of cured. Most of the people will have a recurrence of symptoms. So once they have recurrence of symptoms, they are called back for a final placement of the internal pacemaker. It is in that the same lead is used, which was used for the external pacemaker, and by a small surgical procedure, a small battery with a special electric signal device, it's placed inside the buttock, and it is connected internally with that electronic electrode. At the end of procedure, the patient is given a remote control, which is operated by wireless means, by which the patient can switch it on or off or change some minor settings. It starts working from the day one it is implanted, and the person will have the benefit from day one, although there will be some adjustment issues like pain or discomfort which will take some time to adjust. Sacral neuromodulation has again revolutionized the management of these voiding problems, particularly urge incontinence. And in patients in whom it is implanted, like those who have failed the earlier form of therapies, it makes a huge difference in their quality of life. Up to 70% to 80% people of urge incontinence feel much benefited. The results in the other group, like pelvic floor spasticity or pelvic pain, are not as promising, but it's still, before going for a large mutilative surgery, it is worthwhile trying this before going for it. When we are considering results, it is basically a lifetime commitment, because this battery will work for about 10 to 15 years, and some issues will keep on coming up, like setting up. Sometimes it's working, sometimes you feel that it's working less, sometimes the the electric signals are causing some discomfort. So it needs the patient to come back to the doctor office, and in consult with the technical support from the Medtronic company, these issues need to be sorted out. But all in all, the results are very promising.